Hey everyone, thanks for joining me. It's Dr. Whimsy, and today we're having a conversation about a condition that a lot of people ask me about, and that is Candida. Do I have Candida? What is Candida, and how do I treat Candida if I do have Candida? So chronic Candida, or a chronic yeast infection, we also call it chronic Candidiosis. That is a condition where we have an overgrowth of a type of yeast known as Candida albicans. Now, to be clear, there are all kinds of yeast, and yeast is a really big phylum. If you're looking at the fungi phylum, it's a whole phylum, so it's a complicated, there's a lot of diversity within the yeast kingdom. But we're only talking about one type of yeast, and that is chronic candidiasis. So we're not talking about mushrooms. We're not talking about therapeutic mushrooms like reishi or chaga or any of the good medicine out there. We're talking about something very specific. Now, normally everyone has some candida in their body. It's benign. It's not going to hurt you. The problem is when it becomes overgrown. And that is when we start to see problems. Now, what are the symptoms if you think that you've got a candida overgrowth? You may experience fatigue, malaise. Chronic fatigue syndrome is sometimes paired with candida overgrowth. We see those two phenomenon happening at the same time. Person says that they have chronic fatigue, and then we find out that they also have candida. Being depressed, being sick all the time, feeling like you have a depressed immune system, seeing thrush or a white coating on the tongue that you can't scrape away. Being susceptible to migraine headaches can also be a sign of having candida. Gas, bloating, upset stomach, chronic urinary tract infections, dark circles under the eye, feeling, a sallow look sometimes, just being tired all the time. Those are all symptoms. Feeling drained. My patients who suffer from candida often feel drained. In terms of the testing we run to determine if somebody has a candida infection, you can do a stool test and find out if there's an overgrowth of candida in the stool. Also, antibody testing can be done. To be clear, we don't assume that if somebody's up and running around, we don't assume that they have candida in their blood. I've had some confusion from patients who think that they've got candida in their blood. If you've got candida in your blood, that's usually a sign of an extremely depressed immune system. We might see systemic candida in the blood in somebody suffering from HIV, but usually a person who has candida, it's usually somebody who they have an overgrowth in the digestive tract. It's more common in women than men, and you might also see candida overgrowth, vaginal overgrowth of candida. So what are some of the causes of why a person might be vulnerable to getting a candida infection? Chronic infection can sometimes be a risk factor for developing candida later in life. People who've had a past history of mono, they'll have a depressed immune system, they get mononucleosis or Epstein-Barr virus, and that can depress the immune system, making them vulnerable to other opportunistic infections like candida. So a depressed immune system, some type of a depressed immune system, like a virus, chronically getting colds, which also may lead to chronic antibiotic use. If you're constantly taking antibiotics, that can destroy the good flora of the digestive tract, and that can also make you vulnerable to candida. Birth control pills, hormone dysregulation, it's one of the reasons why women are more vulnerable to candida infections than men. Poor pancreatic function is something that we also see in people who suffer from candida. That's where you have trouble digesting your food. You may not be producing adequate amounts of pancreatic enzymes, and so undigested food makes its way to the lower digestive tract where it becomes food, both for Candida and also unfriendly bacteria. In people with poor pancreatic function, we may see both small intestinal bacterial growth along with high levels of Candida in the digestive tract. So in addition to poor pancreatic function, you may also have low stomach acid or hydrochloric acid. That can also lead to trouble digesting food and also an increased risk for infections in general. What are some of the drugs that are traditionally used to treat Candida? They're what we call the antifungals. Nystatin tends to be the medication of choice when naturopathic doctors prescribe a medication, but we also see doctors prescribing ketoconazole and also fluconazole. These are just the antifungals. Sometimes they can be a little bit hard on the liver, and so for that reason people may choose to go with naturopathic medicine instead. So what are the treatments that we recommend for people who suffer from Candida? Well, the first thing we do is we start to clean up the digestion or put people on what are called Candida diets. These can be extremely strict depending upon how quickly you want to heal from your condition and how severe your condition is, but certainly we want to look at removing sugar and processed foods. There's some evidence that removing dairy may also be beneficial. Fermented foods, some fermented foods are advised to abstain from. We also recommend avoiding foods that are fermented like alcohol and beer. Some cheeses, definitely the moldy cheeses, may also aggravate a pre-existing condition. I always prescribe digestive enzymes to people who have Candida or any kind of poor pancreatic function. Usually a good digestive enzyme taken prior to meals can help with any kind of gas, bloating, and upset stomach or aggravation of Candida. Probiotics are a must. I usually want to go with a good quality pharmaceutical grade multi-strain probiotic, and there are definitely some great ones out there. Other things that I like to offer to people who have Candida is what we call the Anti-Candida herbals or supplements. There's been some great research on medications like berberine. That's an herbal antimicrobial. We also see some good results with garlic, oregano oil, and caprylic acid. The other thing I like to do is to focus on building the immune system, and that when we talk about building the immune system, we talk about things like taking a good multivitamin, keeping your vitamin D levels up, but also I'm a big fan of what we call the adaptogenic herbs, the Chinese formulas that help support adrenal health, and I tend to find that patients do very well on those. There are some medicinal mushrooms, depending upon how far along in the condition a person, how serious the condition is, and how many supplements a patient's willing to take. But some of the medicinal mushrooms can be quite helpful, in addition to some of the Chinese herbs that are traditionally called adaptogens, like ginseng, rhodiola, and some of the other great adaptogenic herbs. So that basically is the protocol. There's about 5 aspects to the protocol, starting with number 1, the diet. Number 2, making sure to support healthy digestion with enzymes and probiotics. Number 3, we really want to start giving antifungals, herbal antifungals right away. And then 4, building the immune system, and 5, definitely adrenal support. So that pretty much wraps up a typical program you would see if you were visiting a naturopathic doctor and you were being treated for Candida. If you'd like to find out more about my work, you can go to drwhimsy.com, and if you'd like to schedule an appointment with me, you can book directly online. And I'm also available for telemedicine appointments if you are not in the Los Angeles area. I want to thank you for watching this video. My name is Dr. Whimsy Anderson, and I look forward to speaking to you again soon. Take care. Bye-bye.